Welcome to the 19th Annual CARRE Conference. My name is Barbara Otto, and I'm going to be the moderator of Creating Connections, Sustaining an Integrative Reentry Service Delivery Model. Since March of this year, the Illinois Department of Corrections has released nearly 2,000 individuals as a result of J.B. Pritzker's executive order to provide early release to individuals who were near the end of their sentences or needed medical furloughs due to vulnerable health conditions. The executive order zeroed in on 36,000 male and female inmates in the 28 different facilities, the vast majority of whom, because of their close proximity and contact with each other in housing units or in dining halls, are especially vulnerable to contracting and spreading COVID-19. Today we have with us Sherie Martinez, Associate Vice President of Behavioral Health at the Safer Foundation, Jacqueline Hernandez, Behavioral Health Counselor at Healthcare Alternative Systems Incorporated. And we are so fortunate to have two individuals who were willing to share with us their reentry stories, Mr. Delon Horn and Ms. Jacqueline Helm. Thank you all for joining us today. Well, before we get started and learning more about reentry and how to improve reentry services, I'd like to talk with you, Jacqueline Helm. I'd like to hear about your personal reentry story during a time of COVID when many of the offices that you needed to access weren't open. What were some of your biggest challenges when you were returning home?
My thing was you have stipulations you have to do, which is either anger management or mental health or just easy as going to the doctor. When I came out, I had no idea how to do. First of all, I didn't know anything about the COVID as much as I do now when I was in there. So when I got out, just by going to the store, you can't even cough or sneeze, without people, looking at you, and you have to wear a mask 6 feet. I didn't really know. I knew like the 6 feet, but I didn't know how much of extent that COVID-19 had on society like it does now. So when I came out, as far as like going to a doctor for a physical, if you don't have COVID or you have an emergency, you can't be seen. You couldn't be seen right away. I came home like in April, so it was like the month after. It was like, don't leave your house and stuff like that. Like that was issued for Illinois. So I found a doctor that would let me come in and do like a proper physical because I've been gone for a while, so I wanted to make sure that everything of myself is okay. I got that taken care of. I also found a place finally for anger management, but I would have liked to do that one-on-one because I have a lot of, issues that, maybe I need to express stuff that's, bothered me over the years. And I couldn't do that. So I had to do it over the phone, and it's not the same, it's really not like, people say it's easier, but for me, I wanted that experience. I needed that experience. Also for mental health, same thing. I needed therapy. I couldn't go in and get therapy like I wanted to, like anybody else, sit down and talk to my doctor without like a biased opinion. I couldn't do that. So I had to do it over the phone. And sometimes your phone doesn't work. I'm not hooked on technology at all. So that really played a big thing when I first came out, was all the new stuff. So it was like, how do you do this? How do you do that? You got to download this. You got to do app. Like, I was like, my mind was blown. So it took a little while. Had to be very patient. Also finding a job. Also with the technology that goes in play, having to do everything on the internet. They don't want you to come in for an interview. They want to do it over the phone. But you can't be there to kind of tell your story like, hey, I have a past, but I've made a mistake and I'm, want to better myself, and I would hope that your company would take me. And I got a couple rejected at first. I even got a place that was like, hey, we'll train you, but when your background comes back, we'll fire you. And it was discouraging, But I finally found a company and I stuck with them through the whole way, went through training, and besides of COVID and everything, just be safe and stuff like that. And I was able to work. And then school came along and found a school that would do not e-learning. This is like hands-on. Like I go every day, Monday through Friday, like legit. So
That's great.
yeah, so I needed that. I didn't want to do stuff on the, like I said, technology thing with me was not working out. So I was like, I need hands-on. So I found a really good school for me, and I've been doing both them things ever since. I still go to therapy, when I can, because my schedule is really crazy. But as far as like the COVID it was definitely, you would think it was a change when you went in, but when you came out and dealing not just with adjusting to society, but adjusting to society with a pandemic was hard. It was.
Sherie, can you walk us through the Safer Foundation's response to the governor's office request for support to work with this early release population?
Sure. So around, the middle of March is when I would say COVID-19 kind of went mainstream and everyone was rushing to the grocery stores, stocking up on food, and a lot of offices, closed their, a lot of organizations closed their offices. And nobody really knew what was going to happen, I think, at that point. And about a week later, after that happened, it was a Saturday, I believe, and we got a call from the governor's office. Wasn't really sure what it was about. And then we participated in the call with, it was Safer Foundation and Heartland Alliance initially. And then it later included Task and Women's Justice Institute and some other organizations. But basically they were letting us know that in order to limit the spread of COVID in prisons, that they were going to start releasing thousands of people early, starting with pregnant women, elderly individuals, people with serious medical conditions, and then people who were nearing the end of their sentence. And then they were asking us, if we could help support these individuals coming out during this time. And then we asked, when it was going to begin, and we were told the following Tuesday. So this was like a Saturday, Sunday, and we had 72 hours, 48, 72 hours to figure out how we were going to receive this high volume of people. Now, we normally receive individuals all the time, but I think just the sheer volume and the fact that it was COVID and the fact that our offices were closed, we needed to kind of figure out a process. So we had settled on Safer Foundation helping individuals who were returning to Cook County, with the exception of Sheridan and Swick prisons, and Task working with people being released to areas outside of Cook County. So we scrambled to create an early release hotline. We put it together a one-pager for IDOC, just letting people know that they're returning to Cook County. This is the number they can call. Then we agreed on a process where everyone who was coming out before they were released were given opportunity to consent to have their information shared with Safer. And then we pulled together a team that we called the Early Release Response Team internally of different staff from different departments. We needed people to serve in this capacity, people to staff the hotline, people to serve as reentry navigators. A lot of the staff were already doing this work. Some staff were more focused on employment. Some staff were more focused on behavioral health. So it really became a multidisciplinary team. And when we get these consents sent to us from DOC, they would be assigned to a reentry navigator who attempts to make contact shortly after they're released and then triage their immediate needs.
Jacqueline, let's talk a little bit more about that. How did you find out about Safer Foundation or even some of these service providers?
Yeah.
Did anybody tell you how to navigate this, how to find a healthcare provider, how to apply for benefits? Did you have a state ID? How did you do all of this?
Well, there was two main factors in that. The main one was that I joined reentry program when I was in there. So I
Okay.
started and it was by phase 1, phase 2, phase 3, and phase 4. So by the phases, one of the phases was actually like education, job, and health. Whether that be like just your regular health or mental health, all you know. And if somebody came in and there was like guest speakers, it'd be like a guest speaker, like not if not every day, we'd have one like, once a month, where people come in and talk to us. So they had a big convention. It was called the Reentry, like a Reentry Summit. And I actually met somebody from Safer, got their information, and I actually kept with them when I was in there. They came in and I think they were helping us do like what do you like? What are you interested in? Like find your ideal. Like what do you like? Not what do you think like you want to get by, but what do you see yourself doing like as a career long term? And they also brought in like health providers. Like okay, well what area you're gonna go in, and hey you could go here, you could go here. So I felt like out of all the people in the summit, I felt like they were the main ones that kind of like stuck out to me. So I kind of like signed up with them and I stuck with them ever since. And they actually helped me get my ID when I was inside. Like I have my ID in my wallet right now, like my state, like
Wow.
yes. And until I came home, so I have a state ID, like, but like legit, like they brought the state of Illinois Secretary of State like in there, and I have my ID like from Illinois.
So one
Like I
thing
needed that.
it sounds like it really worked for you that
Yeah.
the Secretary of State came on site
Yeah.
and helped you get your state ID.
Yeah.
That's great. And you heard about Safer through the Reentry Summit.
Yeah.
Tell me a little bit about how you were able to access a healthcare provider once you got back into the community.
So when I was linked up with Safer, I met this really, really great guy from Safer named Victor. Ever since through my pro agent, and she was also like that was the second factor, like her too, like connecting me, like connected with somebody from Safer. She helped me out a lot, and I met him, and ever since day one, since I think it was like I want to say the second day I was home, he was just always constantly calling me. I didn't have to go find him or nothing like. So he helped me out with the anger management, the healthcare, the even the stimulus. Because I came out and I didn't have anything. Food stamps. If it wasn't for him or just his knowledge, I probably wouldn't have any of that. And I'm really serious. Like he's a really great guy, and now he got me involved in more like seeing what he could do for somebody like me. I just try to give back, because that's a big deal, man. Because some people and don't have anything. So a couple of people that came home that were friends of mine, I actually got him linked with them, and they're doing good as well. So it's a good feeling. So thanks to him a lot.
So it sounds like when you re-entered, Victor, who was one of the re-entry navigators,
Yeah,
got in touch with you. That's fabulous.
yeah.
With us today, we have Mr. Delon Horn. Delon, can you share with us your experience of when you were released from the Department of Corrections and the type of challenges you faced in the community?
Yes, ma'am. Absolutely. Thank you for having me. My name is Delon Horn. I was released from prison March the 20th, 2020. And since my release, I've been working with Miss Charisse Arriola over at the Safer Foundation and a couple of others, but she's been my primary connection. And I was released during the COVID-19, the start of the pandemic. And I had a real tough time adjusting, not only with finding with employment, the mental issues with getting out, the stay-at-home order, getting birth certificates, MVRs, Social Security card, all the things that I would need to get out and get on my feet. I had issues with food, getting clothing, and it was hard. It was real tough. And I connected with Safer. I had heard about them inside, and I also was a participant of some Safer Foundation help back in 1993. So I turned to them when I got out because I had nowhere else to go. No other programs existed to help me, or I knew no other place to go. And so I reached out to Safer in hopes that they could help me. And it just so happens, I got connected with Miss Arriazola, and they was there for me. They helped me with so many things. I mean, like I was at a point of getting ready to give up, go back to the streets, do the things that I'm used to doing, because I, I mean, I had nowhere else to turn. And I thank God for Safer. I thank God for Miss Arriazola. I turned to them. They helped me with food. They helped me with clothing. They helped me with a place to live. They uh they helped me with employment, and they talked to me. They just didn't treat me like a nothing or a nobody. They was generally concerned about my welfare, my well-being, concerned about me not returning back to prison, not returning back to the streets, not returning back to doing robberies and crime, because I was almost at my wit's end. And they spoke with me. They offered me mental health. They offered me moral support, and not only the financial support and transportation support, so I could get around on the bus, the transit system here in Chicago. They helped me. They helped me to help myself. That's the word I'm looking for. They helped me to help myself. And and like I said, in the midst of the COVID-19, everything was closed. People was working from home. People had their problems and their situations and their families. Safer Foundation and Miss Charisse Arriola, they took time out of their lives and out of their busy days and dealing with the pandemic to help me. And with they help, I was released March the 20th. And by March the 27th, I had my first job. My first job came by way of Safer, and it couldn't have came at a better time. I got hired on with CARRE, community outreach efforts, doing the COVID testing here in Chicago. And it was a great opportunity. It was a great experience. I was so grateful for it, and I was so grateful to Ms. Arriazola, because not only it was a job, not only it was a chance for me to turn my life around and get on my feet, it also was a chance for me to give back to the community. I'm out here, I'm testing people in my neighborhood, in our city, for COVID-19, educating people about COVID-19, and doing the testing and helping those. I have so long, my whole life, just took from the community, just kept taking and taking, and I felt uplifted because I finally had a chance to give back. I finally had a chance to be a part of the solution instead of part of the problem. So I went into that job and I loved it, and I worked that job, and I was helping people, and I was starting to get back on my feet. Things started to working out. I was able to find a place to stay for a little limited time. I was able to start buying my own food, and I was able to see myself be in a position where I can make a difference. And then when I got that job, it looked like all the doors started opening up for me, because Safer gave me the tools I needed to learn how to get on a computer and fill out applications, to get on a computer how to put in resumes and cover letters. They taught me how to talk in an interview. They taught me how to explain myself, how to conversate and express myself in interviews. They taught me how to fill out application. They taught me how to fill out W-2 forms. They taught me how to fill out I-9 forms. None of this stuff I knew before. And I mean, I was so grateful with them, I wouldn't have made it. And it just so happened, upon me learning those things, I started getting on the computer. I started learning the computer. I started getting familiar with a computer. Because a lot of us get out and we computer illiterate. We just don't know how to operate these new computers and these new Apple phones and these new tablets. And Safest, they taught me a lot of that. I don't know everything now. I'm still learning, but they gave me the tools I needed to get my foot in the door, and how to surface the web myself and put in applications. And with their support, I started putting in applications. And one day I got a call from Home Depot. Now, Home Depot is a Fortune 500 company. It's a big company. It's a conglomerate company. And I was like, well, I'm putting in applications to see what happens. And through the things I learned from Safer, how to talk, how to put in the applications, Home Depot called me in for an interview. And when I went in the interview, I explained to them my situation, and I explained to them my skills, uh, my job readiness, customer service, and I explained to them I had a background and everything. And the man said, you know, usually they don't hire felons with my type of felon. You know, I have armed robbery as a felon. But he said, I like the way you speak. I like the way you express yourself, and you was honest and you told the truth. He said, so I'm gonna run it by my manager, and I'm gonna see can we hire you and get you in there. So I kept on working with CARRE, and then finally 3 weeks later, I about gave up on Home Depot. They called, and they called for me to come in for another interview, and I went in for the interview, and I did the same exact tools I learned from Safer and Miss Arriazola, and they hired me. I got hired, and I got hired with Home Depot June the 5th. Now, I got out March the 20th. I already done secured 2 jobs.
Wow.
Now, at this, I mean, God is good. And now I'm working 2 jobs. I'm working CARRE in the morning. I'm working Home Depot at night. But in the midst of work, ma'am?
No, that's amazing, Delon. So
yes,
one of the things I'd like to ask is, given all the challenges, you know, between COVID-19 and having a record, do you think it was really important to have someone like the Safer Foundation to help you navigate all of these things?
It was absolutely important. Without Safer Foundation, Miss Charisse Arriola, I would either be back on the streets selling drugs or robbing people or dead. Because it's no way possible I could have did this, not only with a felony background, but during this COVID-19. No one's hiring. People's at home. Unemployment numbers are up. And I found 2 jobs in the midst of that pandemic. And the only way I found it because Safer Foundation and Miss Sherie, Arizona, they took time with me. I mean, they didn't even have to do it. They working from home. They got their kids running around in the background and in the living room, and they on the phone trying to do work and help me. I mean, who else does that? And they was patient with me, and it was not like a rush order, like, okay, I got somebody else to get to. They talked to me. They wanted to know my concerns. They wanted to know what I was going through. They want to know my mental thinking, and they teach you how to be honest. You know, you're not gonna get nowhere lying or pretending, because this is real life out here. Right. I know my situation. I'm a felon. I know my situation, and the tools they offer and the help they offer, it gives you a sense of pride. It gives you a sense of wanting to do better. Yeah, I mean, it's easy to give up, go back to what you used to do. It's really easy because I almost been there. Trust me. I mean, I was that close, and they sit down, they talk to me. They help me with food. They helped me get clothes to go to the job interview. They helped me get clothes. When I got the job, I needed steel-toe boots. I needed jeans to work in. I needed warm clothes to work in. And I needed safety glasses. I needed all these different things, and they was there for me. And then once I got the job, I got to get to the job. 2 weeks before I get my first paycheck, I called upon Safer again. They was there again. Something they didn't have to do. I mean, I know there's programs, is funding, and things like this, but they didn't have to take that extra time out to help. They wanted to make sure that I wanted, you know, I wanted to do better. I wanted to live. I wanted to be a part of society. They helped me with bus transfers. They helped me with bus fare. They helped me get to work. If I couldn't get to work, they'll send out a van to take me to work. If they couldn't give me the bus cars and bus tokens, they helped me. They helped me with interview skills. They helped me with resume skills, cover letter skills, things I heard about but never knew anything about. And they helped me with food so I can eat. And they showed me so many different techniques and so many tools to use that I didn't have to turn back to the streets. I didn't have to turn back to the things that I was used to because Safer was there. And I mean, I'm in the city of Chicago. It's a real big city, but it's not too many programs at all that does the thing that the Safer Foundation does. And then to find someone, a job specialist, a job coach like Sherie Arriola, I don't know how I got that lucky. I don't know how what I did to deserve that best, because I don't even think nobody would even help me that far. I mean, she took time out her busy day, out her schedule, uh, just to make sure my mindset was right, to make sure that I was okay mentally, that I was okay with going through this struggle. I don't have to turn to go give up, go use some drugs, go buy some drugs, get high and say forget it.
Right.
I can't do it. You know, it's nothing out here. It's a COVID. It's a pandemic. Nobody's high. I'm gonna stay home and get high. And if I get broke, I go pick up a gun and go rob a gas station. I didn't have to do that with them. I didn't have to do that. And I mean, I'm not gonna sugarcoat it. I'm not gonna tell you a lie. It's been a couple of times when I was that close, because that's what I know, and that's what's easy for me to
And
get out.
it's frustrating. I'm sure it was
Right,
frustrating to be
right,
locked up and isolated.
right, absolutely. And you can't eat, you can't go here, you can't go there, and it's so easy to turn to that. And I thank God for them, because I didn't have to make those choices. Someone there was there to help me. Someone there was there to help me help myself. I mean, it's nothing given to you there. They're not gonna just give you anything, or just here go you do that. No, you got to want to do better. You got to want to do something. You got to want to get up and go to work, get up, go look for a job, get up and go put in applications. You got to learn, you got to want to get on the computers, learn the computers. And so you could put in the application, so you could fax the resumes, and you could send off the cover letters. And they gave me the tools I need to do that.
Sherie, can you walk us through the process and how you work to recruit Jacqueline and Hernandez and some of the other partner organizations?
So we quickly realized we were going to need help. Like, there's just no way we were going to solve or address all of the needs that individuals face by ourselves. So we quickly started to kind of develop a list of providers that we wanted to reach out to. And then we called on the Lieutenant Governor's office to help us put out this call to providers. So a notice went out to various listservs, the Health Advocates listserv, Behavioral Health listserv, Criminal Justice Advocates, associations, trade associations, pretty much. And then we convened a call, I think that Monday. So it was really, everything happened really fast. Pretty much asking the public, so to speak, or the field, this is what's happening, who will help us? And we also put out some parameters. We did a survey asking who's willing to serve people who have pending Medicaid applications, because we knew a lot of people were going to come out without active coverage. And as long as we did an application, would you accept somebody? We really wanted to make sure we had coverage for Northwest and South sides. We wanted to make sure we had FQHCs, community mental health providers, DASA or now super providers, organizations to help with basic needs, support, clothing, food, shelter, housing providers. So eventually we got responses, and it's the people who were involved in this or who agreed to be a part of this became the PEERR network, the Prison Emergency Early Release Response Network. And that at the end of the day, it trickled down to about 7 or 8 providers that we ended up partnering with the most, and who kind of stepped up from the very beginning. And that was Haas, Heartland Alliance Health, Transforming Reentry, also known as Men and Women in Prison Ministries, Colby Jailhouse Ministry, CAM Alliance. I don't know if I'm forgetting someone, so I'll have to go through my list and make sure I say their name before
Put up a list
or I'll hear about it. But so we had created a structured process by which we refer e-fax or secure email information about this person Are their benefits active? Or if not, do they have a pending Medicaid app? What are we referring to them for? Then the providers agree to spit back to us that appointment was scheduled, when it was scheduled, who it was scheduled with. So we're able to have secure linkages rather than just telling somebody to call 800 number and just hope that they are successful navigating that system, which we knew that wasn't going to work. So the process we have in place is works really well, I think, and we are sometimes able to troubleshoot with each other if an individual missed an appointment. And then we can, on our end, do our part the next time we talk with that individual to say, hey, I talked with so-and-so, you didn't show up. Things like that. It's just better able to coordinate. And then together, we're able to provide a broader array of services to people who have a multitude of needs. So together, we're bringing access to access to an array of services that they probably wouldn't be able to navigate on their own. Employment, housing, clothing, food, substance use, mental health, primary care, psychiatric care, transportation, employment. So that's kind of where we are today. We've been seeking funding to support the network. We were hoping to get a grant. We did not get that grant, but we proceed to look for opportunities because this is not, even though COVID catapulted this happening, it's not something that should just remain with COVID. This is how reentry should be. And we're hoping to sustain this work and make it a standard part of the process.
I guess as a policy analyst, which is, I'm in awe of service providers like Haas and Safer Foundation. I am amazed that this is not a way that we do business in the state of Illinois, that reentry is really left up to individuals to navigate a bureaucratic maze of services. Just, even prior to COVID-19 and the unique barriers that COVID-19 created, especially the issues around Medicaid. As a health policy analyst, I'm amazed that we have individuals trying to navigate Medicaid on their own and actually maybe even required in their parole requirements to be getting a behavioral health assessment. Jacqueline, how do they even find out about Haas if it weren't for a coordinated network like PEERR?
I think the PEERR network really helped in providing these list of services for them of organizations in order to complete their parole stipulations. It's a very important service that I think that is helpful for the basic needs that they have. Most of parole clients, have support from their family, but some don't. And they're kind of coming out and they're a little lost as to how can they be helped with these stipulations that they're supposed to complete. And I think Safer Foundation has made this process so much easier instead of them having to look online or, who can take me and help me with these parole stipulations. I think Safer Foundation and the PEERR network has just created this process so much easier for them.
Sherie, what I'm really have been interested in is this notion of you setting up a HIPAA compliant way of sharing information and also creating a network of providers that are willing to take individuals that have Medicaid applications pending. Can you talk a little bit about how it worked previous to the PEERR network and how it's working now? Post PEERR network?
I think before we kind of knew how to navigate the system, but then clients would go to other providers and be told one thing, and then we kind of were like, oh, I wish we could have been there, or I wish we could educate other providers on how to serve this population. And we even advocated with HFS to put out a provider notice so providers know how to tell if individuals' benefits are still suspended. So it was, we, kind of knew how to navigate the system, but we didn't see everybody. So we can only help who we saw. And now with this, I think even if they're not getting all the services from us, we're able to help set them up properly. So when they are received from our partners, the partners have what they need. We've even, we do try to make sure everyone has active coverage before we make the referral. If they don't have active coverage and it's absolutely necessary and urgent that they get services, we will do the app and let the provider know that it's pending. We've even told some of the providers in our network how to hold on to claims and not bill them until the approval occurred so that they could still get paid, because getting paid is crucial. There has to be a funding stream for the services they're providing. We verify everybody's insurance in the Medi system to determine if there's no coverage, if there's the IDOC hospital benefit package while incarcerated. If we find out their benefits are suspended, which happens with most individuals, we notify HFS and ask them to release the hold to reactivate the benefits. If they have no coverage whatsoever, we do a new app, and then we request that that app be expedited if there's medications involved or anything like that. If the person came out with a script from Wexford Health, for example, and they have coverage, they can just go to the pharmacy. And there's been times where we were on the phone with Walgreens or Jewel-Osco, advocating for the client and letting the pharmacy know this person does have coverage, this is their RIN number, they're on Medicaid fee for service, and they were able to get their script filled. So it's a whole complicated process, and people think that it's a challenge to get coverage. It's a challenge to know that you have coverage. It's a challenge to know how to get your coverage back on. And then once you have it, it's a challenge to know how to use it. So there's a translation process. We need to translate and speak the language of parole, speak the language of healthcare, of Medicaid, of housing. We have to be able to understand the systems that our clients are in and be a mediator and translate to expedite access to those systems. And it's a skill. I mean, it's not that I don't want to say we're experts. It's just, that's what you have to do to get services. You have to do that. Otherwise, clients get lost. They go back to what they were doing before, that what got them in prison in the first place, because they need money to survive. And they end up back in the emergency room, or they end up back in prison. And we've seen it even throughout COVID.
I think it's really important to note that that studies show that the first 2 weeks after release from incarceration is a really critical time for returning residents. And I think COVID and the social unrest that many may have experienced when they were released from custody was particularly hard in the last 6 months. Jacqueline, how did the changes in COVID, maybe even the fact that many needed technology in order to access services, how did that impact some of the people you were working with?
Oh, it did impact them a lot due to, depending on the age group, not every age group knew how to work Zoom, computer, even basic phone apps. So we try to make that transition even smoother with, just being approved with telehealth services so that we can actually see, just speak to them over the phone for those that couldn't navigate through Zoom, and walk them through it. And but we did individual sessions over the phone, or we gave them the option, because we did know that this was a very crucial time for them, and helping them in any way through this process was important.
Great. I think that's something that a lot of policymakers don't think about, is the importance to have that connection to a behavioral health counselor, or to just a reentry navigator. Sherie, can you share some of the whole person benefits the PEERR network provides? I think that's something that we often don't think about, the range of navigation supports that people really need to be successful.
There's a combination of services that are provided by SAFER and with our partners. Together, we're able to provide insurance verification, Medicaid applications, SNAP applications, care packages. So that includes some clothes, boxers, toiletries, like a backpack. We have a limited supply of cell phones for those that are staying at a halfway house and all have to share one phone and we're not able to get in touch with them. We have access to substance use providers, substance use, all levels of care, mental health, community mental health providers, primary health clinics, FQHCs, which offer, medical care, psychiatric care, and even medication-assisted treatment. Employment via SAFER, so resume writing, job readiness training, employment placement, help with getting to and from work. With some jobs, we're able to transport clients. We have a fleet of transportation vehicles. And then we're also able to help them with like work boots and clothes and things like that they need. Coordination with parole is huge because a lot of individuals are on electronic monitoring and they can't just simply go to work. We have to get approval for them to start work or approval for them to come to an appointment. So that's critical. We also have, for those whose parole sites have changed or they can no longer stay there, we work to get them housed in either immediate shelter or transitional housing or an apartment. We have a small subsidy with the help of Illinois Justice Project and some other foundations to help fund some assistance with rental assistance. I forgot to mention earlier, Legal Counsel for Health Justice receives our referrals for those who want to, who might have a disability and who want to apply for SSI, SSDI. I think that's the gamut. I might be missing something, but those are pretty much the array of services. And we couldn't help clients with all those things if it wasn't for the network and for organizations like Haas. And the fact that we're able to coordinate instead of just giving them a number and a piece of paper and an address makes it real and makes it, it just makes it holistic.
Jacqueline, could you share with us a little bit about how the PEERR network is helping you help your clients?
Absolutely. So as Sherie was saying, the process has just been easier and we try to communicate all the time. They send us the referral, which has a lot of basic information that has been so useful to us that a lot of times pre-COVID, pre this relationship, we needed like parole agent's name, the Medicaid, as we were discussing, IDs, all of those things that seem so basic were a problem even before COVID and just became a bigger problem during COVID. So SAFER Foundation has made it so much easier to just have a form and email it to us, and the form just has the information that we need, like the parole agent's name, the Medicaid number, what type of service they need. And then we reach out to the parole client and we advocate for them by scheduling those appointments, making sure that we're taking into consideration, timings and, whether or not they have childcare issues, things like that a lot of people might, overlook, but we try to make sure that the basic relationship between us, parole, and SAFER Foundation is always in direct communication at all times during the process, from beginning to end of treatment.
Well, this sounds like this model is really working. And given that the title of our panel is Sustaining an Integrative Reentry Service Delivery Model, what recommendations should we be moving forward with the state when it comes to sustaining this kind of activity? As a policy person, I would say one of the first things we should really be doing is recommending that we connect returning residents to healthcare as soon as possible. From listening to you and from talking with Jacqueline Helm and others, that healthcare connection is really critical. What recommendations, Sherie, do you have moving forward on that healthcare connection?
On the healthcare, I think there's been there's been several laws that have been passed to try to mandate enrollment, but we still have had
Enrollment
the
in
majority
Medicaid?
of our,
Enrollment in Medicaid?
Yes. There's been several laws that have been passed to try to require Medicaid enrollment pre-release from incarceration. But yet during COVID, the majority of people coming to us when we verify their insurance don't have anything or their benefits are suspended. So what we have now is not working. And I think we need to look at what other states are doing, such as Pennsylvania, which has done an interagency data exchange between their Department of Corrections and their state Medicaid agency to automate the enrollment process to verify identity and to verify income. I think you need reentry navigators to do what we're talking about and to serve as a one-stop shop, but not if not at one site, at least with a firm network of partners. I mean, there's other recommendations that I can talk about outside of Medicaid. I think in addition to that, we did not talk a lot about state IDs, but when the Secretary of State offices were shut down, we had a list of about 100 people who needed IDs and who we couldn't get started in employment. Employers will not hire unless you have a state ID or a social security card. So we had a backlog of 60 people who could not get work. And we were filling out stimulus checks like no other applications, trying to get people some immediate income. And if people don't have a means to live, I mean, what's the alternative? So I think, we need to look at, I know with advocacy, the state eventually started to start mailing out IDs after 2 weeks or so after someone's released, but I want to encourage us to think about how we could issue IDs on the day of release with a parole site verified. How can we look at employment? What are things that could be done while you're inside that could expedite your ability to get a job sooner? The IDs are critical. If you have that on day one coming out, you can start looking for jobs right away. If you have that resume in hand on the day that you come out, you can start looking for jobs right away. So what are some things that we can start earlier in the process so that we can expedite employment when people get out? Because the lack of IDs, the lack of resumes, and even some job readiness training, if those things happened inside, we can start initiating the process either right when they get out or even maybe a little bit prior to when they get out. There's transportation has been a challenge. We, have been able to provide transport to some of employers who are out in the suburbs. A lot of the jobs that are available are in the burbs. And so we help transport those individuals to those jobs. There's also, I'm blanking out right now. I know there's a lot of other things. Housing is a huge issue. They passed the Just Housing Amendment in Cook County, yet we still don't have a network of landlords that are willing to rent to somebody with a record. We have a 311 process for immediate shelter, which is not ideal. We have some IDOC contracted transitional housing providers, but they can only stay there for 60 to 90 days, and then what? So, the housing has been a huge barrier, and there's a lack of housing. There's no housing. And I don't know how we could do any of these other things if somebody doesn't have anywhere to live. I think we've had a few people get returned back because they have nowhere nowhere to live. So we've been strong advocates of trying to address this issue and create some housing opportunities for returning residents.
Housing, I know, is a huge issue. I know that some people, some returning residents actually end up being discharged with family, and sometimes that doesn't always work out. So we really do need to think about housing. And Jacqueline, you also talk a little bit about how families need to be prepared and supported. Do you find this with some of the clients that you've worked with?
Yes, absolutely. That's always a big issue. And it all has to do with, I think, preparing the family. I think during COVID, because there were so many early releases, they were prepared maybe months later for the, client to be released. But that because, it was, rushed, everyone was getting released early, they weren't prepared. They weren't prepared physically nor mentally. And I think part of that is crucial for the client as well, for the family who's trying to support the client, to maybe have some help for the family along the line, to whether it's therapy or income or something to just make this transition so much smoother. And those that don't have families to support, I think that's one of the things that Sherie was also talking about with housing. If you don't have a family to come out to, where are you going to go? Where are you going to live? And, those are basic necessities that even trump their substance use treatment, their mental health treatment. Where are you going to live? Are you going to eat? How are you going to survive during those things before, having to, complete these parole requirements? And I think that is one of the things that is really needed, is to have that support system, whether it's family, friends, or just, the peers that or the organizations or whatnot, that we can support them to make this transition so much easier.
I wanted to add that there are some families that are willing to support individuals coming out, but they live on Section 8. And
Yes.
they can no longer, we've had a lot of clients call us for housing because they're technically not supposed to be where they are. And the family is there, they want to support the individual. And because they can't, we have to put them in a worse situation, a transitional housing provider. And people want to stay, a lot of people don't want to be in those type of environments. And they look at it as kind of tied to IDOC still. And so I think, we have tried to look at ways where we can get housing ourselves, because we've been having such a challenge trying to find housing. Let's just build it. But yet a lot of the funds out there don't allow for acquisition and rehab. So there's a lot of funds for housing out there, but it's only for services and not for brick and mortar. And so if there could be a real examination of funds and what's missing, instead of just throwing money at services. Services are needed, but there's also basic things like 4 walls and a ceiling, or you know what I'm saying, that are required. And you can't keep prohibiting organizations from spending money to do that. That's just, we need to get more creative. We need to look at what the gaps are, and we need to look at the real human experiences and stories of clients.
So what I'm hearing is that we also have policies, but we also have practices, because there's nothing that in federal HUD policy that says people in Section 8 can't have family members with records stay with them. As I understand that, that's a local policy. So there are some policies and practices that we can be changing. To summarize, I hear you talking about the importance of that connection to healthcare, and recommending to the state that we look for strategies to be connecting people with healthcare upon discharge, that we look at improving our housing policies and practices, taking a look at how landlords and even our Section 8 housing can be more equitable for people with records. I heard Jackie talk about how we need to be looking at supporting families. And all of this sort of aligns with what we've been hearing even from Jacqueline Helm on the issues that are important to her. Finally, I heard you talking about the importance of state ID and having proper identification, because as I understand it, you can't even apply for Medicaid or any of the other benefits without having that state ID. We know that we're going to have decision makers listening to our panel. If you could say one thing to decision makers about what is most important to make reentry successful, what do you think those things would be?
As far as right now, because we don't know how long the COVID is going to be, I definitely think there needs to be, for people that like me that didn't have the knowledge, like I had somebody help me with my technology. People that don't know, who's been in there 20 years, 25, they don't know. They need to take either, I would think, honestly, a technology class, somebody help them. Also, a big thing for me is that make sure they get the proper mental health. A lot of them have issues, a lot of things that have just built inside, that make sure they get that. Regardless of anything else, that they need to make sure that they get the help that they need. Because like I said, they've been through some things and it's not easy. And especially dealing with that and then coming to society definitely is not. Especially I think they could do a better plan for as far as how they're dealing with COVID and like people's mental health issues. Like I said, I was in the scene for a while. Imagine if I had an episode. Imagine if it was just too much for me. You know, which at one time it was everything coming from all ends. So I think that is very important. Also, I got county care, so make sure they get the proper care they need for their health. They got to be checked out.
One thing I've heard you talk about is the importance of having supports for reentry once you're home and once you return to family. Returning to family can also be challenging, and so families need supports in addition to individual support and learning how to reintegrate into family. Do you have any thoughts about that?
Maybe this is just me just shooting a shot. Honestly, I wish that when I came out, me and like a couple of my family members went to therapy, went and talked some stuff out. Like I haven't been around them in a long time. When I came home, it was hard. It was like getting to know me all over again, you know? So it was kind of starting over. It's like the person you did know is kind of like it changed a little bit. So yeah, it was very hard. My family still struggles with it as to this day. Sometimes they don't know what and what not to say, only because of where I honestly, the sad thing to say is that because I came out, and they don't want to make sure that I don't have any triggers, nothing's wrong with me, that I stay on the right path that I've been going on. So family, I definitely, to me, it would be like therapy or something with them, or maybe you only get a visit with them for like an hour or two, and then after that it's done. So I think that's important. And trying to there was one class that wasn't in the reentry, which I would think like it is problem solving, but like and how to deal with situations, but not with family. Like I think maybe based on okay, well, if your mom says this, your grandma says that, if they react to this, how do you react to it? That wasn't on there. So that would be kind of interesting to maybe implicate that in there. That would be pretty cool.
Well, Jacqueline, I really can't thank you enough for all of your contributions, not only in sharing with us on this panel, but also in some interviews that you've done to help us with our PEERR report that talks about the need for more coordinated and formalized reentry services. What are your personal and professional goals? I wonder if you feel comfortable sharing them with us, because you've been so helpful.
Yeah, absolutely. Honestly, right now I'm going to school for welding. So, and that's all aspects of welding: pipe welding, TIG, MIG, stick. I just wanted to follow my dream and try to do something different, something that is hard, that, you know, you gotta, something that you can control. So I think right now that is like my passion. So I'm trying to implicate my passion in welding, but also honestly just to try to give back to the community. So girls like me, because I went in at the age of, you know, 18, girls like me don't end up like where I was. So to really give back and to try to, if I don't change a lot, maybe I change one, and that's all that matters to me in my heart. So those are my main, like, that's my personal goal. You know, my professional goal is honestly is welding. I work, you know, but that's work, you know, but I don't like it. I don't love it, but I love welding. So I'm trying to stick my 100% into that right now. So I'm blessed. But thank you very much for, you know, interviewing me, being able to speak. It means a lot.
Well, thank you. I mean, actually, it's truly my pleasure. Thank you for sharing your time. I know that you're a very busy woman. I know that you're busy in your training program and moving on to the next, your what's next for you. But thank you, because your voice is really important, and we appreciate you.
Yeah, thank you very much. Thank you. Thank you.
Delon, you know, there are a lot of decision makers or policy makers who think a lot about reentry, and they may even be listening to our panel discussion today. What would you tell them about the importance of reentry services?
The reentry program and services are very important. They are very vital to our society and our community. Not just here in Chicago, Illinois, but across the country. The prisons are overcrowded and the guys are getting out. It's a revolving door. I was in there and I seen the guys would get out and they'll return right back. And without programs like this, crime rates with numbers would just skyrocket, because a lot of guys get out, want to do better, but it's just they feel like it's no help for them out there, and they feel like there's nowhere to turn to or no support. And programs like this not only save lives, it gives a person a chance to be part of the community again. It gives them a chance to want to help themselves. And a lot of guys are not looking for no handout or nothing given to them for free, but they want something where they could work towards some kind of programs that would help them, give them a push in the right direction. And those are the programs that we really do need, because trust me, I'm living proof. It saves lives. And like I said, I got released March the 20th. By June the 5th, I had found two good jobs. And I couldn't have done it without Safer Foundation or programs like Safer Foundation. Not only the programs they offer, it's the staff that works there. The staff get involved with you. They follow your progress. They call and make sure you're on the right track. They make sure you're doing what you're supposed to do. They talk to you about your mental thinking. They talk about how you feel it. They want to know what you're going through, what you're thinking, and what can we do to help. And with that support, a lot of people would get out of prison and feel they can make it. They feel that they're not nobody. You know, I'm not nobody. I mean something now. I matter. And that's what we need, those type of programs.
Thank you, Delon. That is
Yes.
exactly why we need these programs. You're living proof.
Yes,
I appreciate you, and I appreciate you taking time out of your busy day to help us with this.
yes, ma'am. I was glad to do it. Thank God for Safer Foundation. Thank God for Sherie, Arriazola, and thank God for programs like this all across America. We need them.
Panelists, is there anything else you'd like to add before we end our panel?
Oh, sorry, Sherie.
No, go ahead, Jacqueline.
No, I just want to really thank Sherie and Safer Foundation for assisting us with this, with the PEERR network. I think it's a great, way of servicing the client better. And I think partnerships like this is something that really helps and can be beneficial, and the expansion of that would just be great. And even though the positive that can come out of COVID if anything, is that it created this partnership in order to help people from parole better. And hopefully we just continue with this service and just to help the parole.
Thank
This
you.
is just a great platform to talk about the issues. I think we've been on the ground, and it's been nice to come up and talk about the experience. I think we would ask for help to sustain this effort and not let it fizzle out and disintegrate. It's working, it's comprehensive, it's holistic. And it would be a shame to let something like this dissolve because we didn't have funding to sustain it. So I would just ask for any help, whether it's sustaining the work, helping remove some of these practices, and helping bring about some of these reforms that we're talking about today.
As we always say, in every crisis comes an opportunity. And I believe with COVID, this opportunity of having a more restructured reentry process could be the one bright spot coming out of what we've all experienced in the last 6 months. So thank you. Thanks everyone for your participation.
Thank you.
Thank you.
Wonderful. It's just such a joy to be back together talking about this important work. Thank you all for joining us for this important panel. I want to remind everyone that you can submit any questions you may have in the Zoom Q&A. But we do have one question. Jacqueline Hernandez and Sherie Arriola Martinez, and we're about to have with us again Jacqueline Helm. Can any organization become a part of the PEERR network? And how can an agency be vetted to be a part of this collaborative?
So I think it's the same kind of set of questions we asked back in the end of March, which was, are you willing, if you're a healthcare or behavioral health or substance use provider, are you willing to accept people into services knowing they have a pending Medicaid app, since a lot of people come out without active benefits? We're currently serving individuals in the Cook County region. So as long as you have coverage there. Also, are you willing to have our reentry navigators refer and make appointments, schedule appointments for clients, and willing to collaborate on attendance and progress and things like that. Housing remains the number one issue. We do have a good network, I believe, of FQHCs, mental health and substance use. Housing remains a challenge. Any basic needs support is also helpful. The months are getting colder, so we're kind of going into this phase of PEERR, which is we'll see what challenges the weather brings, and we're gearing up to make sure we have coats and things like that in stock for clients coming out.
Great. In viewing the panel again and hearing the great words from two of the PEERR participants, it seems like employment is such a critical component, especially now with COVID-19, of keeping people engaged and keeping them, helping them reintegrate. How has SAFER communicated to employers why it's important to hire folks with backgrounds? Are employers convinced to take on this risk? And I see another question here from the audience. Are there particular industries or companies that are more likely to hire folks with backgrounds than others?
So I think there's a few things I want to say about this. I think the latter part, once people realize that 1 in 4 people in America has a record, or if they or someone that they know close to them has come into contact with the justice system, it kind of breaks this black box that puts people with records in an other category and brings it closer to home. And I think people realize that these are just individuals who for whatever reason ended up in the system. And some people are more affluent and can fight the case and don't have to plead guilty and don't end up in the system. So I think that personal experience really helps. It's platforms like this that I think humanizes the population. Instead of talking about it like some abstract thing, it brings it to a face. So I think a lot of work is done by our organization to help break the myths and to help lift up client stories. And I think that has done a lot of work to I think people just don't know, and they just have this picture in their head of what someone with a record is. And I think once you bring those stories and the more we normalize it, the less of a fear there is out there. I hope I answered that well. I'm sure Victor Dixon could have done a better job, but that's my perspective on that.
Well, I have a question now for both you and Jacqueline. From what we've heard from the panel, both our panel participants and from both of you, and just the work I've done over the years, we know how critical access to healthcare is for returning residents. What is being done to resolve this issue?
Well, I think for one, Safer Foundation makes it easy to at least get the Medicaid process going. Once they come to our agency, for example, or any of the agencies that are involved, we try to provide them with a list of places that accept Medicaid. So for instance, depending if they have managed Medicaid, like County Care, Line of Care, and whatnot, I'll log into the computer and find the nearest place that accepts that, so that we can set them up with an appointment if need be, or at least a list of like the 3 closest locations to them, and then give that list to them so that they can call and make the appointment. But if they need help with making the appointment, we'll do that at the end of the assessment appointment process.
That's great. I mean, structurally, I'm wondering what can be done to connect people with healthcare before they actually leave custody at IDOC. Sherie, are there any policy work on the horizon to be able to do that?
There's a lot. I mean, this is an issue that if you've been in this space at all, you're aware of. And I think a lot of legislators are like, didn't we solve this problem already every year? And no, it's not. There's a lot of people who've come out. I think we've gotten up to 800 or 900 referrals since the end of March. And about 50% of them come out with either suspended benefits or just no benefits. Several laws have been passed to try to mandate enrollment, but I think the lack of funding to hire staff to do that work at all the prisons is a challenge. There's work on the federal side to remove the inmate exclusion in federal Medicaid law, which is the law that prohibits Medicaid from paying services while people are on the inside. So there's been work to push that back to allow for at least 30 days. We're pushing for an automated solution. States like Pennsylvania have automated their enrollment process via a data exchange between their Department of Corrections and their state Medicaid agency. So their process is pretty much automated by data matching to verify identity and to verify income. And they did that with a mixture of federal and state funds. And I truly think that to me, enrollment should be as ingrained in the reentry process as fingerprinting is in the booking process. Like, it should just be an automatic step. And so I think that we need to be more forward thinking with the solution. We've been trying for years to just mandate it and rely on staff or different personnel to do it. And it's really complex. And I think we need an automated solution.
Absolutely. I mean, I'm really hoping we can see some investment in infrastructure. It sounds like it's an infrastructure issue between state agencies, and it's. I know the legislature's been grappling with this, and all of us have been pushing forward recommendations for at least 5, 6 years. So I hope this makes it into the governor's and lieutenant governor's justice initiatives, criminal justice initiatives. Are you able to help individuals located outside of Cook County? It's one of the questions we just got.
Yeah, we have offices in, we have several offices in Chicago. There's one in South Holland, which is the Cook County suburbs. And we also have offices in the Quad Cities region, which borders Illinois and Iowa. I mean, we want to expand. We've proposed funding. We've tried to seek funding to expand our services to other areas of the state. We've done some work with the Urban League in Springfield, and we've tried to talk to potential partners in East St. Louis and Southern Illinois. So, I mean, that's definitely something we want to do. But right now, we just have several offices in Chicago, one in South Holland, and a few offices in the Quad Cities region.
Well, I know from doing this work as a partner organization that this work can be really labor intensive and time intensive. Do you have any dedicated funding, Jacqueline or Sherie, for this work?
We do. We have a lot of help. Even if someone didn't have Medicaid active by the time they came to us, there is some government funding like Super, formerly known as DASA, City of Chicago, things that we can at least waive some costs, certain things on a sliding fee scale, just definitely something to make that transition a little smoother until they receive their Medicaid. But there is definitely a lot of help that we can provide if they don't have Medicaid as well.
For SAFER, a lot of our services are not covered under Medicaid. And so the work we've done and the process we created in PEERR, we started without any funding. We took staff from different departments. So the staff, we had some counselors, we had some employment specialists, we had just a mix of staff that we kind of had an emergency response approach to the work once we were told people were going to be coming out. So we've been trying to apply for funding. Right now, like I said, we've gotten about 800 to 900 referrals, and we're severely understaffed on our end. We don't want to stop the work. It's kind of hard to scale back the work. You can't pick and choose what prisons you're going to get referrals from. So we've gotten some funding for about 2 to 4 FTEs with the help of CJA, but we really need about 5 or 6 more reentry navigators. We need someone specific to housing. So, I mean, we are really trying to find ways to sustain the work. The holistic approach that we're doing now. If we were to scale back, we would not be able to offer this suite and holistic menu of services for folks, which would be really unfortunate. So, we have, had hopes that the state would implement the supported employment and housing waiver pilots that would allow our services to be funded under Medicaid. So we continue to keep an eye out on that. But right now, we really are relying on a lot of grant funds.
Yeah, I know we've all been working on those pilots for a while now. So if anybody from the state is watching, I would encourage some movement on that. For those of you who are unfamiliar with the PEERR network, I strongly encourage you to go to the registration page, and we have a report up there on the PEERR network that Smart Policy Works co-authored with our partners at SAFER Foundation. But let's take one last question. And since housing is a major challenge, and many of the transitional placements, shelters were full during COVID or not operating. We had to have alternative setups rather than congregate housing. How did SAFER handle clients during that time as it related to people who did not have a good housing situation upon release?
That experience brings back some trauma for me personally when COVID was in full effect and we saw all these articles, saying that there's all this money coming for housing, but then when we would try to access it for our clients, it wasn't accessible. 311 was it just wasn't a realistic option. You just couldn't get through. People didn't want to take anyone. They're nervous to take people coming out of prison because of COVID. So it was a real challenge. We tried to work with different transitional providers that were out there. We honestly got some assistance from the Cook County Justice Advisory Council, who really, the people coming out of prison is not really their main responsibility, but I think when I would, tell them about certain stories, they would really try to see what they can do. So I truly appreciate them. We also recently, finally, thank the Lord, got some funding from the Illinois Justice Project via several foundations to provide rental assistance to up to 20 individuals on parole. So right now we're just trying to go out and do site visits with potential landlords to try to see what arrangements we can make with them. Most of our clients are working, but they can't get an apartment either because nobody wants to rent to people with a record, even though the Just Housing Amendment was passed in Cook County. And just that whole process is just really hard right now. So even if you are working, you're doing all your mandates, you're doing everything you're supposed to do, and no one will rent to you. So that remains a huge challenge. But that's kind of, we just kind of took all the leads that we could during that time when people were struggling with housing. We even considered hotels, like putting people in hotels. Like there just really wasn't a lot out there. But I would really have to thank the Cook County Justice Advisory Council because they did help us with a decent number of folks.
That's great. Well, I do want to encourage everyone, if they have any additional questions after the conference, to send them to care@saferfoundation.org. I also want to encourage everyone to go to saferfoundation.org just to download the PEERR report, download recommendations that I know we pulled together with PEERR, and I know there's an upcoming reentry report coming from SAFER Foundation. And I want to thank everyone who participated in this panel. Jacqueline Hernandez, thank you so much. You've been amazing, and I know that Haas has been an amazing partner to the PEERR network. A special thanks to Mr. Delon Horn and Ms. Jacqueline Helm. Your stories were so critical to not only this panel, but it's really important to the work we do. As policy people and as advocates, your willingness to share your personal stories is what helps us get this work done. And again, special thanks to my partners at the SAFER Foundation and to you, Sherie Martinez, for all of your hard work on this. And thank you to everyone participating today.